I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video on severe eye pain on waking. Patients often complain that they go to wake up in the morning, or they wake up and they try to open their eyes and they get this tearing, searing eye pain. It's really quite uncomfortable. The difficulty is it varies. Some days it's bad, other days it doesn't happen, might disappear for a while, might come back. What's going on? Well, this has got a name. It's called Recurrent Corneal Erosion Syndrome. Recurrent, that is, it recurs. Cornea, that's the front of the eye. Erosion, it's literally the skin is eroded away. Syndrome, we love to call things syndrome. So what's happening? Well, when we go to sleep, our eyelids close and cover our eye, and the eyeball itself rolls. Usually rolls up, it might roll out. What should happen is you should be able to open up and the eyelids don't stick to the eye. But there are certain situations where the eyelid can stick to the front of your eye. Now that's a pathological situation. Think about this for a minute. If you take your hand and every 10 seconds rub your hand on your pants, keep going. See how long it takes for the skin to go red, for you to get pain, and then how long it takes for the skin to start falling off. It won't be long, because your skin on your hand is not designed to be rubbed against something, whereas the skin on your eye is. For me to remove your natural skin in its intact state, I've got to use a razor blade, and I really got to work hard. It sticks. Well, the problem in recurrent corneal erosion syndrome is it doesn't stick. And there are many causes. The most common, fingernail to the eye or a tree branch in the eye. Kids do it to their parents all the time. Now, the difficulty too is it might have happened a year ago. You've forgotten about it. So you get this searing pain and you go to see somebody, an optometrist, a doctor, whatever, and they tell you you've got dry eye. Of course you do. Go to the chemist, you get antibiotic drops. So you use it, feels good, and then it recurs. You do the same thing. And you get chuffed off from one person to the next, and in the confusion, you just almost give up. It gets to the point where patients actually say to me, they fear going to sleep because they don't know if they're going to wake up in pain. That is recurrent corneal erosion syndrome. Now, aside from injury, there are other causes. You might have something called map dot fingerprint dystrophy, or epithelial basement membrane dystrophy, or Reese-Buckler's disease, all these technical names for other conditions. But mostly, it's an injury to the eye. Some of the other less common causes happen in menopausal women. Now, we don't know why. So in their 40s to 50s, the skin of the eye just doesn't stick as well. And that often affects both eyes, whereas injury is usually one eye. So what do we do? Basically, there's a whole range of treatment options I can give you. If you have been using drops or ointment and it's not helping, then I would proceed to something called corneal burring, and you can click the link in that below. We've done a video on that. And corneal burring, so far, at the time of this recording, I've never ever had a failure. It's a relatively cheap, office-based procedure. It'll fix the surface of the eye. You will experience pain afterwards for several days, and that's normal, but it is fixable. Aside from that, before we jump into burring, we might give you some lubricant ointments to use at night time every night. And if you're happy doing that and your pain goes, then you're fine. That's recurrent corneal erosion syndrome, a real pain in the eye. I'm Dr. Anthony Maloof from Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and thanks for watching.